Today, we are going to look at a BodyViz brain builder about the urinary system and urethritis. The urinary system consists of the kidneys, ureters, bladder, and urethra. The urethra is a muscular elastic tube connecting the urinary bladder superiorly to the exterior environment. The passage of urine is assisted by peristaltic contractions of smooth muscle layers lining the wall of the urethra. The anatomy of the female and male urethras differs significantly, so we will discuss them both. The female urethra is significantly shorter than the male urethra. As it moves inferiorly, it curves slightly, passing through the pelvic floor to the perineum. The external urethral sphincter allows for the voluntary control of the passage of urine through the urethra. The urethra opens into the vestibule that lies medial to the labia minora and anterior to the vaginal opening. The male urethra, which has 3 segments, moves inferiorly from the bladder, through the pelvic floor, and ends at the external urethral orifice, located at the tip of the penis. The 3 segments of the male urethra, from the most superior to inferior, are the prostatic urethra, membranous urethra, and spongy or penile urethra. In addition to the anatomical differences between the female and male urethras, there are also significant clinical differences between the 2 structures. One of these differences is that the female urethra contains significantly more elastic tissue than the male urethra, making it much easier to dilate. In addition, infection of the female urethra is more common because the female urethra is open to the exterior through the vestibule of the vagina. Let's learn more about urethritis. The suffix itis means inflammation. Hence, the definition of urethritis is an inflammation of the urethra. Symptoms of urethritis primarily includes inflammation of the urethra, accompanied by one or more of the following: painful urination, a frequent and urgent need to urinate, difficulty starting urination, pain during sex, abdominal and pelvic pain, and fever and chills. Urethritis can be caused by sexually transmitted diseases, bacterial infections, viral infections, physical injury, or sensitivity to some chemicals. Treatment of urethritis depends on the cause of the infection. Urethritis caused by bacterial infection will be treated by a variety of antibiotics. Urethritis resulting from a viral infection, such as a herpes simplex virus, is often treated with antiviral medications. Urethritis is preventable and curable. However, if urethritis is left untreated for a prolonged period of time, it can lead to permanent damage to the urethra, as well as other pelvic organs, especially in females. Finally, let's take a look at a patient example. You receive your patient's file and take a look. Age, 20. Sex, female. Chief complaint, pelvic pain. You invite the patient into your office for an examination. Your patient shyly explains how she's been feeling very uncomfortable in her private region, especially when she starts to use the restroom, and she has a hard time feeling comfortable whenever she's sitting. You ask your patient when this began, and she explains how she has been experiencing this pain for about 4 days and had hoped it would just go away on its own, but if anything, it has worsened. Your patient's vital signs show that she has a slight fever, and you ask for a urine sample to run some tests. The urine test shows signs of a bacterial infection causing the urethritis, and you prescribe antibiotics to help beat the infection. You discuss some easy ways to prevent urethritis, like drinking plenty of water and wearing cotton underwear to help keep the area dry. After a few days on the antibiotics, your patient begins to feel comfortable again. This is a classic example of urethritis. Thank you for watching this Brain Builder video. Please like and subscribe to our BodyViz channel. Or if you're new at BodyViz, check out our other anatomy resources and schedule a demo at bodyviz.com.